The latest news from the American Board of Emergency Medicine is now available in a new format. Welcome to the ABEM General podcast.
Hello, I'm Melissa Barton. I'm the Executive Director for Professional and Clinical Affairs for the American Board of Emergency Medicine. Emergency medicine attracts the most skilled, dedicated, and compassionate physicians in the whole house of medicine. Emergency physicians are there to care for patients every hour of every day, regardless of what the patient needs. And today, ABEM is proud to recognize a few physicians who have lent their voices to help us celebrate Emergency Medicine Day.
Hey everyone, my name is Aaron DeMore and I'm a current ABEM resident ambassador panelist and chief resident at the Mass General program in Boston. In typical EM fashion, I decided to pause on the bike path to take this video for all of you on my ride home. Recently, I've had a lot of time to reflect on what is it that I really love the most about emergency medicine, but it's really been hard to just pinpoint just one thing. And I think that really goes to show just what is so special about what we do. Every day we do incredible things, from life-saving procedures and running resuscitations to lower acuity things like helping patients who have nowhere else to turn for their medical care. No matter the patient, the circumstance, or the hour, we answer that call. We step up as a team when we're needed the most. And it's really the people in our specialty that make it so special. From physicians to nurses to techs, EMS personnel, pharmacists, coordinators. It's the staff and working together every single day to provide that compassion and care in difficult moments that makes our specialty so unique. So from me to you, happy Emergency Medicine Day. Thank you to everyone who makes this specialty so incredible.
Hi, I'm Dr. Trupti Shah. I'm an emergency medicine physician at Northwell Health in New York, and I love emergency medicine because I get to see the impact I make in my patients' lives every day.
Hi, I'm Glenn Pato, and I'm an emergency physician in Minneapolis, Minnesota at Hennepin County. And to all the medical students and residents who have chosen to participate in a career in emergency medicine, you have chosen the greatest specialty. We made such an impact on our community. Thanks for everything that you do.
Hi, I'm Dr. Howard Greller. I'm an ABEM certified examiner, and I love emergency medicine because of the stories. And they're the stories that unite everybody, and everyone experiences them, and we all get to share them and help people along the way.
Hi, I'm Luna Ragsdale. I am at the Durham VA and Duke University Hospital. And I love emergency medicine because of all the people who work in it.
And I'm John Fogel. I'm an emergency physician at Mount Sinai Hospital in New York City. I've been practicing medicine for 37 years, and I've seen everything except the pit.
Hi, I'm Jessica Wilson. I'm at UT Health Houston, and I love emergency medicine because it's really the place where we're most in touch with the community and really help people where they're at. So that's me for emergency medicine.
Hi, I'm Deb Dirks. I am a member of the board of directors for ABEM. It is my pleasure to kind of celebrate Emergency Medicine Day. Really enjoy and proud of our specialty, and making a difference in our specialty and improving the lives of our patients is really important. I am fortunate enough to share this great specialty with two of the most amazing people in my lives, Lauren and Kirsten, and I'm going to let them tell you a little bit about themselves.
I'm Lauren Dirks. I'm a Stanford PGY2, and I'm RAM's president. My favorite thing about having my family in emergency medicine is that we can talk through really hard, really funny, and really awesome cases together after shift.
My name is Kirsten. I'm an incoming PGY1 at the University of Cincinnati. My favorite thing about emergency medicine is getting to learn from two awesome leaders in the specialty and two amazing mentors for me as I start my career.
We are really grateful to everyone who works in the emergency department every day. It is nothing like learning from our colleagues who teach us how to be better and how to take care of the best care of our patients that we can. So happy Emergency Medicine Day, and look forward to seeing everyone soon.
Hey, I'm Dr. Fresh. I'm a ABEM doctor, and I love emergency medicine because we take care of everybody. No other specialty can say that, and we do it with passion.
Hi, I'm Dr. Han Park. I'm an ABEM certified emergency medicine physician. I work in Los Angeles, and I love emergency medicine because I learn something new every single day from patients, from other doctors, and just learn something new about life in general. It's a great field.
Hi, I'm Dr. Adam Bloom from the University of Vermont Medical Center, and I love emergency medicine because as a specialty, we are committed to being there for our community members and our neighbors on their very worst day, regardless of their ability to pay. We really are the safety net as a specialty of medicine. I love that about EM.
Hi there, I am Dr. Andrew Jennis. I'm a practicing emergency physician with 26 years of experience. I currently live in Ithaca, New York. I'm a traveler for my group. What I really love about emergency medicine is that I'm able to take care of people on the worst days of their life and able to make an impact for them so that that is not the worst day any longer. That's why I love emergency medicine.
Hi, I'm Vic Parwani. I'm an emergency physician in New Haven, Connecticut. I love emergency medicine for lots of reasons. The variety, the ability to help people in their time of need, and last but not least, also that the turkey sandwiches are great. If you ever had a ER turkey sandwich, you'll know what I'm talking about.
Hi, I'm Rachel Liu. I'm an emergency medicine physician from New Haven, Connecticut. I love emergency medicine because it has given me such a varied opportunity to explore a lot of different things. We're helping patients or other physicians or anyone who needs it all around the world with anything they need. And we have the ability to do that in a very short time frame.
Happy Emergency Medicine Day to all of my colleagues in this amazing specialty. I think having a day like this is wonderful because it allows us to reflect on how far we've come. All the schooling, all the training, all the times we wanted to be in this position so badly, and we're here. And it also gives us an opportunity to be appreciative of the fact that we get to take care of patients on their worst days, and we get to not only save lives but also change lives, and that's just so amazing. So happy Emergency Medicine Day to everyone, and I'll see you on shift.
Called 10-10-1968, reviving a little bird, I would become a healer. February 1991, Desert Storm War, ATLS tent, yeah, emergency medicine. 58 years since that first calling, still showing up, different locations, urgent care, telemedicine, mentoring, coaching, leadership, admin, whatever you created. The calling is still there, very quiet, very deep, resonating.
Follow and join us on social media as we celebrate Emergency Medicine Day, #ABEMProud.
Thanks for tuning in to the ABEM General podcast. Be sure to follow ABEM General so you never miss an episode.